Omeprazole and esomeprazole. They might sound almost the same, but are they really identical? If you've ever wondered which one is better or why doctors sometimes choose one over the other, you're in the right place. In this video, we're going to break down 7 big differences between these two popular medications in a simple and easy to understand way. By the end, you'll know how they differ and what it means for you. Difference 1. Chemical structure. Omeprazole and esomeprazole might look like twins at first glance, but there's a hidden difference in their chemistry that makes them unique. Omeprazole is the original proton pump inhibitor, the first of its kind, and it's been used for decades to fight acid reflux, GERD, and stomach ulcers. Esomeprazole, on the other hand, is a slightly modified version known as the S-isomer of omeprazole. That small change in structure might sound minor, but it can actually affect how your body absorbs and processes the drug. Think of it like two cars that look the same on the outside, but one has a more efficient engine under the hood. Because of this, esomeprazole sometimes works more consistently, especially in patients whose bodies don't absorb omeprazole as well. This chemical tweak can influence not only how long the medicine stays active, but also how strongly it blocks acid in your stomach. So, while the names are similar, this tiny difference in their molecular structure can make a real impact on effectiveness and how your body reacts. Understanding this helps explain why doctors sometimes choose one over the other. Difference 2. Effectiveness/acid control. When it comes to controlling stomach acid, not all proton pump inhibitors are created equal. Both omeprazole and esomeprazole do a good job at reducing acid. But studies show that esomeprazole may provide longer-lasting acid control in certain patients. This means fewer symptoms at night, less heartburn, and a more consistent reduction in stomach acidity. Omeprazole is still highly effective, but its performance can sometimes be less predictable depending on how your body metabolizes it. Imagine taking two different water filters. One consistently removes impurities every time, while the other works well but occasionally lets some through. That's similar to how these drugs differ in acid suppression. Esomeprazole's more predictable effect can be crucial for people with severe acid reflux or ulcers that don't respond quickly. However, it's important to remember that for many people, omeprazole works perfectly fine, and sometimes cost, availability, or personal tolerance will guide the doctor's choice. The main takeaway: even a tiny chemical difference can create a noticeable impact in real life. Difference 3. Dosing differences. Dosing may seem like a small detail, but it can make a big difference in how your treatment works. Omeprazole is usually taken in doses of 20 to 40 milligrams once a day, often before a meal. Esomeprazole is also typically 20 to 40 milligrams, but it can act slightly differently because of how your body absorbs it. Timing and absorption are key here. Even a minor change in the way your stomach processes the drug can affect how well it controls acid over 24 hours. This is why doctors sometimes adjust the dose or switch medications if one isn't giving the expected relief. In some patients, esomeprazole may allow more flexible timing or provide steadier acid control throughout the day. Think of it like two different alarm clocks. Both wake you up, but one keeps you on schedule more reliably. Understanding these small differences in dosing helps you see why your doctor may recommend one medicine over the other. It's not just about taking a pill, it's about getting the most consistent relief for your stomach. Difference 4. Absorption/bioavailability. How your body absorbs a medicine can change everything, and this is where omeprazole and esomeprazole really start to differ. Esomeprazole has been shown to be absorbed more efficiently by the body, meaning a higher percentage of the dose reaches your bloodstream and does its job. Omeprazole's absorption can vary depending on your stomach's acidity, whether you've eaten recently, or other individual factors. This can make its effect a bit less predictable in some people. Imagine drinking 2 cups of coffee. One is filtered perfectly, giving you the exact energy you need, while the other sometimes ends up weaker because some coffee grounds remain. That's similar to the difference in absorption. This is particularly important for people with severe acid reflux or those who didn't get enough relief from omeprazole alone. A more reliable absorption means esomeprazole can sometimes control symptoms more consistently, reduce flare-ups, and improve healing of ulcers or esophageal irritation. Even small differences in bioavailability can translate into better symptom control and fewer treatment frustrations. Difference 5. Side effects. Side effects are always a concern when taking any medication, and while omeprazole and esomeprazole share many of the same ones, headache, nausea, diarrhea, and sometimes mild stomach discomfort, there are subtle differences worth noting. Some studies suggest that esomeprazole may have slightly fewer side effects, but the difference is not huge. It may come down to how your body processes the drug, your health history, or even other medications you take. Both medications are generally well tolerated, but occasionally patients report more stomach upset with omeprazole or notice minor differences in headaches or fatigue. This is why your doctor may switch you from one to the other if side effects are bothersome. The important point here is that even small differences in chemistry can affect how well you tolerate a medicine, and noticing these differences early can prevent unnecessary discomfort. Understanding this helps you be proactive and informed about your treatment, instead of just hoping for the best. Difference 6. Cost/availability, money, and convenience can also play a surprisingly important role in choosing between omeprazole and esomeprazole. Omeprazole is widely available as a generic drug and is usually cheaper, making it accessible for most people. Esomeprazole, while effective, often costs a bit more depending on your region, brand, or pharmacy. This doesn't mean one is better than the other. It just reflects differences in formulation and patent history. For patients who need long-term treatment, cost and availability can influence which drug they stick with. Think of it like choosing between two brands of the same essential product. Both work, but one is easier on your wallet. Doctors take these factors into account along with effectiveness and side effects. Sometimes, a slightly higher price for esomeprazole is justified if it provides better symptom control or consistency. Understanding this difference can save you both money and frustration, and it's another reason to discuss your options with your healthcare provider. Difference 7. Clinical uses/preference. Finally, let's talk about how these drugs are actually used in real life. Both omeprazole and esomeprazole treat conditions like GERD, acid reflux, and stomach ulcers, and for most patients, either one works well. But there are situations where one may be preferred over the other. Esomeprazole may be chosen for patients who don't respond fully to omeprazole or need more consistent acid control. Doctors also consider patient history, tolerance, and overall effectiveness when making a recommendation. It's not about one drug being better in general. It's about what works best for you personally. Understanding these nuances can prevent trial and error, reduce ongoing symptoms, and improve long-term gut health. Knowing the differences empowers you to ask the right questions and make informed decisions about your treatment. Small chemical tweaks, absorption rates, and clinical evidence all combine to make these drugs different, even if they seem similar at first glance. So there you have it, 7 big differences between omeprazole and esomeprazole, from chemical structure to absorption, side effects, and real-world use.